Liver cirrhosis. It is a chronic inflammatory degenerative disease of the liver parenchyma in which the liver is finally converted into fibrotic ball which is functionless. And this is called as liver failure, and this is the end result of the liver cirrhosis disease. The various tests are performed, and these tests must be performed initially and immediately so that the early treatment and management can be obtained in the patient. CBC test, then there is gold standard test, that is abdominal ultrasonography, by which the anterior structure degeneration, occlusion of the vessels, that is the blood vessels, portal vein, bile ducts, they can be visualized, and the regenerative process can be assessed by the sound energy waves. In this disease, there is elevation of the ALT, AST, ALP values, and also the elevation of the creatinine level in the blood. Whereas there is decrease in platelet count, albumin, and the clotting factor protein is reduced. That produces the bleeding problems in the patient. In addition, there is also latest test that is called elastography, and rarely the physician or the healthcare provider has to perform biopsy test. That is, the biopsy needle induced through the abdominal wall into the liver, and the pieces of the liver tissue, they are obtained, sent to the laboratory for histological study, that is the grading of the disease. So these are the main tests which are performed for the detection and classification and staging of the liver cirrhosis. For treatment, we have to advise the patient to quit the alcohol drinking habit, which is the main factor for the creation of this liver cirrhosis. Secondly, we have to treat the viral treatment, that is antiviral therapy, in cases of the hepatitis B and C patients. We have to manage the weight of the patient, that is, we have to reduce the obesity, due to which there is production of steatohepatitis. Similarly, we have to maintain the function of the portal vein, which brings the nutrition and the nutrient and the food elements which are absorbed in the small and large guts and is conveyed through this vein into the liver. Due to constriction of the pressing or squeezing of the portal vein by the fibrotic material within the liver, there is creation of portal hypertension, that is pulling of the or the backing of the blood in the GI tract, liver and spleen. Consequently, there is production of ascites, edema, swollen feet and legs and the face. appears in the patient. So we have to treat the portal hypertension by injection of the furosemide IV stat, beta blocker medicines to reduce the hypertension, portal hypertension, and if it is not possible for the medical treatment, then we have to perform the portal vein bypass procedure. As liver is the main gland which is meant for detoxification process and production of the protein, especially albumin and the clotting factors protein. So the various processes, they are produced by this disease, that is there is hepatoencephalopathy, which produces change of mood, loss of memory, depression, stress, tendency towards suicide, tremors, fits, finally ends in the coma state. Similarly, when there is hepatopulmonary syndrome, there is pulmonary distress, accumulation of fluid in the pleural cavity. We have to drain that excess of the fluid by the draining process. Similarly, we have to perform paracentesis. We have to drain the fluid which is accumulated in the abdominal cavity. So this is called as paracentesis process. Due to respiratory distress, we have to aid the supplemental oxygen therapy to maintain the oxygen concentration in the blood for the other supply of the other living organs of the body. Prolonged treatment of antiviral medicine for elimination of the hepatitis B and C. And it is possible nowadays the treatment of antiviral for 3 to 6 months that can destroy the viruses of the hepatitis B and C. Moreover, we have to perform the screening test for detection of the hepatitis B and C infection so that the early treatment should be started. Then, if the patient is a patient of diabetes, we have to maintain the diabetes by proper drugs, and if he is hypertensive, then we have to advise the proper medication for hypertension.